Imagine sharing your life with someone you love deeply, only to watch them slowly drift away, not because they want to, but because an addiction is pulling them in another direction. Whether it's drugs, pornography, excessive gaming, or any other compulsive behavior, the effects aren't just limited to the person struggling. The life partner, often the silent sufferer, feels the ripple effects every single day. Their trust is tested, their emotions are drained, and their health and happiness can be quietly eroded over time. In this video, we'll uncover the hidden ways addiction impacts life partners, not just emotionally, but mentally, physically, and even financially. Because while addiction may seem like an individual's battle, its consequences reach far beyond one person, often leaving lasting marks on the very relationships meant to be a source of love, safety, and support. When one partner in a relationship struggles with addiction, the emotional toll on the other can be profound and long-lasting. Emotional trauma and stress often become a constant part of daily life for the non-addicted partner. From a medical standpoint, prolonged exposure to emotional distress can lead to symptoms resembling post-traumatic stress disorder (PTSD), including heightened anxiety, irritability, sleep disturbances, and difficulty concentrating. The partner may live in a constant state of hypervigilance, always anticipating the next conflict, relapse, or crisis. This persistent stress triggers the body's fight-or-flight response, causing elevated cortisol levels, which over time can impair immune function, increase the risk of heart disease, and contribute to depression. The emotional trauma is not just about the addiction itself, but also about the unpredictable behaviors that often accompany it. Mood swings, withdrawal from family life, and episodes of dishonesty can make the relationship environment unstable and unsafe. The non-addicted partner may begin to doubt their own worth, questioning why their love and support cannot fix the problem, leading to feelings of helplessness and low self-esteem. Social isolation is another side effect. Out of embarrassment or fear of judgment, the partner may withdraw from friends and family, losing vital support networks. This isolation further deepens emotional stress and reinforces a cycle of loneliness and despair. In the long term, if left unaddressed, these psychological burdens can manifest as chronic anxiety disorders or clinical depression. From a doctor's perspective, it is critical to acknowledge these emotional consequences and encourage both partners to seek therapy. Just as physical health needs attention, mental well-being must be actively protected. Without intervention, the emotional trauma caused by living with an addicted partner can have lasting, sometimes irreversible, effects on overall health and quality of life. Loss of trust is one of the most damaging effects addiction can have on a life partner. And in a clinical perspective, it can fundamentally alter the psychological dynamics of a relationship. Trust is the foundation upon which emotional safety and intimacy are built, but addiction often undermines it through repeated dishonesty, secrecy, and broken promises. The addicted partner may hide their substance use, spending habits, or behaviors, leading the other to constantly question what is real and what is concealed. Over time, this constant uncertainty can produce chronic stress, hypervigilance, and anxiety, similar to the physiological effects seen in long-term trauma survivors. The breakdown of trust often triggers cycles of suspicion and confrontation. Even when the addicted partner is truthful, the non-addicted partner may still doubt their words, as previous betrayals have left deep psychological scars. This distrust can create a toxic environment where communication becomes defensive or hostile, reducing the possibility of open and honest dialogue. From a medical and mental health standpoint, the stress response activated by distrust can raise cortisol levels, impair emotional regulation, and contribute to sleep disorders, depression, or even psychosomatic illnesses. Loss of trust also affects physical intimacy. Many partners find it difficult to be emotionally or physically close when they feel deceived or betrayed. The emotional distance this creates further erodes the relationship's stability and may foster feelings of rejection or abandonment in both partners. Rebuilding trust is a slow, deliberate process that requires professional intervention in many cases. Therapists often emphasize consistent transparency, accountability, and time as key healing factors. Without this intentional effort, the loss of trust can become permanent, leaving the relationship in a state of chronic instability and emotional disconnection, even if the addiction itself is later addressed. Financial strain is a frequent and often devastating consequence of addiction, with direct and indirect effects on both partners. Addiction frequently leads to impulsive spending, job loss, or reduced productivity, all of which can destabilize a couple's financial security. Funds that would normally go toward essential needs such as housing, food, health care, or savings may instead be diverted toward sustaining the addictive behavior. This redirection of resources creates an environment of constant financial pressure, which in itself is a major stressor known to increase risks of anxiety, depression, and even physical illness in the non-addicted partner. From a medical perspective, chronic financial stress has measurable effects on health. The ongoing worry about paying bills, covering debts, or avoiding eviction can keep the body's stress response activated for extended periods, leading to elevated blood pressure, weakened immunity, digestive problems, and disrupted sleep cycles. The partner dealing with these pressures may also experience symptoms of burnout, including fatigue, irritability, and hopelessness, which can negatively impact their ability to function in daily life. Financial strain also fuels relationship conflict. Arguments about money can become more frequent and intense, especially if the non-addicted partner feels that their hard work and contributions are being undermined by the other's irresponsible spending or lack of accountability. This tension may lead to resentment, emotional withdrawal, or even separation. In severe cases, financial instability caused by addiction can force life-altering changes, selling property, moving to less secure neighborhoods, or losing access to quality health care. Such changes can further compound emotional and physical stress. Addressing this issue requires not only addiction treatment, but also structured financial counseling. Without tackling the underlying cause and its economic consequences, the financial strain will continue to threaten the relationship's stability and the long-term well-being of both partners. Neglect of relationship needs is a common yet often overlooked consequence of addiction, and it has profound psychological and emotional implications for a life partner. In healthy relationships, partners meet each other's emotional, physical, and social needs through communication, affection, shared responsibilities, and quality time. When addiction enters the picture, the addicted partner's focus shifts towards satisfying the addictive behavior, leaving little energy, attention, or emotional presence for the relationship. This neglect can lead the non-addicted partner to feel invisible, undervalued, and emotionally abandoned. From a clinical standpoint, this emotional deprivation can trigger feelings of loneliness, rejection, and low self-worth, which over time may develop into chronic depression or anxiety disorders. The non-addicted partner may find themselves constantly giving without receiving emotional reciprocity, creating a one-sided relationship dynamic that fosters resentment and emotional fatigue. In many cases, the addicted individual may also neglect shared responsibilities such as parenting, household duties, or financial contributions, forcing the other partner to take on an unsustainable burden of work and stress. Neglect of intimacy is another significant factor. Emotional disconnection often spills over into the physical aspect of the relationship, reducing sexual intimacy and affectionate gestures. This lack of closeness can further weaken the emotional bond and create a sense of detachment between partners. From a doctor's perspective, the long-term effects of such neglect can extend beyond mental health to physical well-being, as loneliness and chronic stress are linked to higher risks of cardiovascular disease, weakened immunity, and premature aging. The healing process requires the addicted partner to regain balance in priorities and the couple to engage in therapy focused on rebuilding emotional connection. Without intentional repair, neglect can cause lasting damage to the relationship, even after the addiction itself is treated. Health risks to a life partner of someone struggling with addiction extend far beyond emotional strain, impacting both physical and mental well-being. From a medical perspective, chronic stress caused by living with an addicted partner can weaken the immune system, increase blood pressure, and elevate the risk of cardiovascular disease. Prolonged exposure to such stress also disrupts hormonal balance, contributing to sleep disorders, digestive problems, and headaches. Over time, the cumulative effects of this stress can significantly shorten life expectancy. In some cases, the health risks are direct and immediate. For example, addictions involving risky behaviors, such as unprotected sex in cases of sexual addiction or needle sharing in drug addiction, can expose the life partner to sexually transmitted infections or bloodborne diseases. Alcohol or drug-induced aggression can also result in physical harm through domestic violence or accidents. Even non-physical forms of harm, such as exposure to secondhand smoke from substances, can have long-term respiratory consequences. Mental health deterioration is another major concern. Living with an addicted partner often leads to anxiety, depression, or post-traumatic stress symptoms due to ongoing instability, conflict, and fear of unpredictable behavior. The partner may also experience psychosomatic symptoms, physical ailments triggered by emotional distress, such as chest pain, fatigue, or chronic tension headaches. From a clinical standpoint, these health risks highlight the importance of intervention not only for the addicted individual, but also for their partner. Regular medical checkups, mental health counseling, and stress management strategies are essential for reducing long-term damage. Ignoring these risks can lead to a dangerous cycle where both partners' health deteriorates, making recovery and relationship repair even more challenging. Protecting the health of the non-addicted partner is just as vital as addressing the addiction itself. Addiction's impact on family structure is profound, often destabilizing the balance of roles, responsibilities, and emotional bonds within the household. When one partner is consumed by addiction, the family dynamic shifts, forcing the non-addicted partner to take on a disproportionate share of responsibilities such as childcare, financial management, and household duties. This imbalance can lead to burnout, resentment, and emotional exhaustion. Children, in particular, are highly sensitive to these disruptions. They may feel neglected, confused, or even responsible for the addicted parent's behavior, which can affect their emotional development and self-esteem. From a clinical perspective, children raised in such environments are at increased risk of anxiety disorders, depression, and behavioral issues. They may also adopt unhealthy coping mechanisms or replicate addictive patterns later in life, creating a generational cycle of dysfunction. The non-addicted partner, while trying to maintain stability, often experiences social isolation due to embarrassment or fear of judgment, further reducing the family's access to external support systems. Addiction also undermines the emotional climate of the household. Tension, mistrust, and unpredictable moods can create a high-stress environment, leading to constant conflict or silent withdrawal. In severe cases, the instability can result in family separation, custody disputes, or complete estrangement between members. From a doctor's standpoint, maintaining family structure during addiction requires a multi-pronged approach. Medical treatment for the addicted individual, therapy for the partner, and supportive interventions for children. Early involvement of counselors, support groups, and social services can help prevent long-term emotional and psychological damage. Without addressing the ripple effects on the entire family unit, recovery efforts remain incomplete, and the structural damage caused by addiction may persist even after the addictive behavior is controlled. In conclusion, addiction, whether it takes the form of drugs, pornography, excessive gaming, or any other compulsive behavior, does not exist in isolation. Its effects seep into the fabric of a relationship, weakening trust, straining finances, damaging health, and breaking down the emotional bond between life partners. It disrupts family structures, creates emotional wounds, and leaves scars that can last far beyond the addiction itself. From a medical perspective, the toll is both mental and physical, often affecting the non-addicted partner as much as, if not more than, the person struggling directly. Recovery is not only about ending the addiction, it's about healing the relationship, restoring communication, and rebuilding trust from the ground up.